All right.
Hey, Nick,
What's
how you
going on?
doing?
Living the dream, man. Thanks for joining me.
No problem, bud.
So, no, but seriously, I know you're really busy, so we do appreciate myself and my followers you taking the time to come chat with us a bit about what you do and how it's unique here in Atlanta. I'm just sending out a thing to some people who wanted to get an invitation.
Not a problem.
So, all right.
So, Nick, tell us about your practice with PT and what you do.
Me? What's new with me? Well, we're we're doing our best with the COVID-19 stuff. I've been doing some telehealth work, some house calls, and then, as you know, I do some over at ACU. I'll come in and see some people out of your office as well.
Cool.
Just really trying to keep everything available for people and keep them safe as well. I know that you over your office, you guys are offering the COVID-19 testing. Is that right?
Yeah, we have the regular swabs who essentially tickle your brain, and then we've also got the antibody testing. And so right now, what's kind of cool is the insurance companies are at least waiving the antibody test for now. So there's no patient responsibility for an antibody test, which is excellent.
Yeah.
And Stephanie, both Stephanies up front, they screen patients for COVID-19, and we also practice social distancing. So, we're always wearing a mask here, no matter what and who we're around. That way, it just allows us to, protect our staff and our team. So,
Awesome. Yeah, no, that I did notice that whenever I come over there, that you guys always are practicing the proper precautions straight from the beginning, even before you guys were giving out the tests. So that's pretty awesome.
no
Uh,
problem.
how did you get into that? Because you guys are obviously your urology office. COVID-19 testing, that's a great service to have for your clientele. How did you wind up getting like into doing the COVID-19 testing too?
I think it just happened, as the pandemic kind of unfolded in the United States. You just need people to step up and help people. So I want to help all my patients, and I think it's just really important to be able to offer this. I mean, we were one of the first places to offer it. And it's drive through. You pull up to the fifth floor. We have private parking for our patients, and they get swabbed and they drive back down again, and they can head on out. I just think it's just something that kind of happened as a healthcare provider. Your job is to look out for your patients and their best interests. So we just called the labs and we said, send us more swab sticks. So we've been testing from the beginning.
Yeah, yeah, that's great. And actually, uh, it kind of brings up something I noticed about you as a practitioner when I first moved here to Atlanta about 2 years ago. Zero was kind of on the forefront of like whatever was going on with urology, and it's interesting to see you transition into that just with as COVID-19 rolled out. You kind of rolled with those punches, and you stayed ahead of that at the same time. I mean, it's completely impressive. Um, like what else in urology, like how did you get into your own practice, because I think it's fairly new, right, that you
Yeah,
started.
good
How
question.
do you do
So
that?
I did my residency at the University of South Florida, and then I did my fellowship at Baylor in male infertility and andrology and sexual health. So my background is definitely skewed into the one arm of urology, that's sexual health and male infertility. Low testosterone, hormone replacement therapy, ED pathway. And then I started with another practice here in Atlanta. And then I just felt that I needed a chance to express myself. And I wanted the practice that I worked in to reflect that. And also, I wanted to have state of the art technology for when we see patients, and I wanted to be able to integrate technology into the way I treat and see patients. And I just wasn't getting that where I was before. And I wanted to have a say, where I was. And I felt that it was important to, be able to talk with my patients and show them things. And we have flat screen TVs in every room. There's we use minimalistic lines. we're not trying to like create an environment where it's a sterile environment. We're trying to make it like more like a family, like the waiting room looks like your living room. We're trying to make it so this is more of a personalized, customized care sort of practice. And I think that, going into, hormone replacement therapy and, testosterone replacement therapy, as well as, pelvic health in general, just made sense in urology. For me, being a sex health physician, it's just important, and that area is important. There's a lot of these low T centers, and somebody has to come up and be the bar and the standard. We have a lot of people coming in asking about what, some of these shockwave therapies is, and I'm the only practice in Georgia that's got a linear shockwave machine for, vaginal rejuvenation and for ED. So, we can use that, and you can even use that in PT as well for linear shockwave therapy. We're the only ones that have that, and a lot of other people charge exorbitant amounts of money, but we have a clinical trial for specifically for ED and Peyronie's disease, which is essentially just penile curve, in Atlanta. So we're the only ones in Georgia with the machine, and we have the only clinical trial for that in the area. So we're always looking to be at the forefront of what's happening in our field. I believe that, if we let other people dictate and speak for us, we end up with situations, where, uncomfortable truths come forward, and like these people that are not really in charge, or, patients are taking care of people that shouldn't be. I think that's what's happening across the United States as far as, even how this pandemic is playing out. You have people speaking up when they shouldn't, recommending medications and therapies they shouldn't, and I stay out of what isn't, my realm, but I definitely will delve into and help people in areas that I can, help all my patients any way that I can.
Yeah, that's great. How do you try to stay, like, how do you stay ahead of all of that? Is there just a lot of reading that's involved, or do you go out to conferences? What's that all about?
You're right. You gotta go to meetings. Right now, I'm doing virtual meetings. I keep my ear to the ground, look at the journals, and talk with other physicians around the United States to see and kind of pick their brains. I've been on a couple of international telephone calls to see what the Chinese are doing. We, to our detriment, ignored what they were doing initially when they were, closing their hospitals and building new ones, and, closing their cities down. We kind of ignored what they were doing in America, and that kind of came back to hurt us. So I've been on some international conference calls with the Chinese, across the United States with different companies to try to learn what's happening and how this pandemic will change to a new normal. It's now acceptable for you to wear a mask. I bet you if you would have told me, Nick, you're going to run around with a mask 6 months ago, people would look at you and be like, maybe he has chemo or cancer or something's going on with him. But now it's totally socially acceptable for you to walk around with a mask out public. And I think those are going to be new norms for us,
Yeah, actually, it's funny you say that, because I said to one of my patients today, I don't even know if I feel comfortable without a mask on anymore. Like, if
Yeah,
people see my face and my
when you kind of think
expression.
about how dirty we were before, it's kind of like, you're like, wait a second. Yeah, you go to the airport and you wouldn't wear a mask, and you probably wouldn't wash your hands after you went through the security area. Now people are like vigilant on that. But I'm hoping that the backlash of this is that, we have a better time with, things like the flu. I'm hoping that, while maybe this December may be a little bit more of a second COVID wave, but at least maybe 2021 and 2022 and going forward, we have the ability to curb things better. And I think that's just, being smart about what's happening.
Yeah, absolutely. Now you're a family man though now, right? You have a 4-year-old.
Yeah, I've got a
Am I?
4-year-old and a 7-year-old. Yeah, the two
Oh,
boys,
okay.
they definitely keep me busy, and definitely mess the house up. So, it is what it is. But I
I was
love
gonna say,
them.
because no, go on.
You love them, and it just sometimes just like, sometimes it's enough. It's having kids is all joy and no fun. I'll tell you that. It's wonderful to try to teach a new mind things. It's absolutely amazing. My wife has done a wonderful job with homeschooling. I think that, every mother that stepped up to the plate is like, and we ask you to take on this extra. It's something else to add on to their plate with. I want you to raise our next generation and do that. So, it's definitely humbling, to be working in these times. But, I I think that, moving forward, we're going to be in a situation where, like, online stuff and, less, more tech is coming into our lives, and we're actually, communicating with people in new ways. And, 9/11 was a wake up call for the airline industry. And I feel like for our industry, this COVID-19 has really pushed telehealth. I mean, before this, I would do maybe one telehealth every month or two. I wouldn't do that much telehealth because, the insurance companies, A, don't pay for it. And B, a lot of patients are like, well, I can find somebody in my area, and so now that, some insurance companies, are saying, hey, they're going to just have reciprocity for like all medical licenses, which is pretty awesome, which means, I can treat a patient in Vermont, which I could never do before, because they're accepting my medical license here in Georgia and saying, it's available everywhere, which I think you would think in 2020, if you get a medical license in the United States, it's good everywhere. It's not. It's only good
Absolutely.
to practice in that state. It's really backwards,
Yeah.
especially as technology is everywhere. And if you want to look up the person that's a specialist for like ball pain, you could find them and you go see them, or whatever, so.
Yeah, so that's amazing. I actually didn't realize that they did that reciprocity now
Not for everybody. Only certain states are doing the reciprocity.
okay. Oh, that's amazing. And have you had any of those people like out of state now? I think you said you
Yeah.
did. Vermont was one of them. Like you actually did work
Yeah,
some of
and
that's
we've
amazing.
had Vermont, North Carolina, Philadelphia, Pennsylvania. We've had a few people come in and just chat with us, and I think it's nice because you can get another opinion on something, and especially when you're talking about surgical therapies and you're talking about infertility. Those are very, very, very touchy, taboo subjects. That people just want, hey, can I get another opinion on it? And now I'm a telephone call away, and we've been using Doxy.me. They didn't pay me to say any of this crap, but you don't have to install anything. And I think that a lot of our patients are older. We do have a fair younger population for the infertility side and the hormone replacement therapy side. Definitely, there's a lot of younger people, but we also have an older cohort of patients, and they really don't know how to download whatever and this app and Zoom and all this. And with Doxy.me, I just send them a link. They click on the link in their phone, and boom, it works. You know,
Yeah.
um, I think it's just an easier way, and it's more secure. It's one of the few HIPAA compliance, and I know that the Medicare and the FDA and the government CMS have backed off, and they're not going to enforce HIPAA compliance during the pandemic. They've actually said they wouldn't go after anybody that violated, like if you use FaceTime. Before they'd go after you for a HIPAA violation. Now they're like, okay, we're going to let it slide. I just didn't want to get into a habit of using something that would potentially come to harm me later. You know.
Well, good for you. I mean, and that's good for both you and the patient, if they ever try to kick something back because something wasn't done properly. But yeah, no, Docs.me, I have some familiarity with it. It is a great interface. I'm glad to hear that you're using it as well.
Yeah.
Um, and actually, I mean, the fact that you're so versatile, you have in-house, you have the Doxy Me, you go out to the cars, you do all these different things, and something else that I've grown to appreciate about you as a urologist and just a healthcare practitioner in general is that you are so open-minded to this growth and that there's not one cure fits all. So some people that I've met in the past, are very much, we're going to do. You go to this urologist, it's for the surgery. You do very conservative management as well. You do both surgery and conservative management.
Yeah.
That's how I think I've become acquainted with you is because I'm a pelvic floor physical therapist and I was getting a lot of referrals from you in the beginning when I first moved here. Can you tell me a little bit about how you became acquainted with pelvic floor physical therapy as a practice? Because definitely not all urologists know about it. I know that your residency, your fellowship, probably exposed you to that. But
Yeah.
can you tell me a little more?
Sure. So I think the first time I thought about physical therapy for the pelvis was when I was actually studying in medical school and looking at Netter. And I came to realize that there are more muscles of the pelvic floor and the pelvic bowl than there are that moves your knee, that moves your arm and your elbow. And so, it just didn't make any sense to me when I'd sit there and be like, we do all this physical therapy for people that have surgeries after all these orthopedic surgeries. But if I do anything in the pelvis, it feels like it's taboo. How did these guys and gals get left out? You have all these women that are delivering babies, right? And you have all these guys that have these pelvic surgeries for one reason or other, hernia repairs, radical prostatectomies, all these different surgical procedures that can cause pelvic and perineal pain, and that causes like voiding dysfunction. It causes problems with defecating. So during my residency, we would send folks, and my fellowship as well, we would send, I would see women that, were, they would do better with just physical therapy. And sometimes they would say, hey, I don't want anything, or I just want to pessary, I don't want surgery now. Because, it was a way of toning up the pelvic floor. And men that have surgery to remove their prostate, the pelvic floor starts dropping, right? Just like after women, lose the muscle tone after having childbirth. They lose that muscle tone, the pelvic floor starts dropping. And how do you strengthen the muscle? You use it. So I think it's, physical therapy for the pelvis. I was first introduced to the concept, in residency. But I always thought about how many muscles am I looking at in medical school, and I've been using it ever since, because if I can get out of doing surgery on somebody, I think that's a win. I use surgery as a last resort, and I try to tell my patients honestly, like, look, if you're having testicle pain, you're having ball pain, you're having, leakage or whatever, you're having a problem, there are definitely modalities surgically to fix you. And if everything is, a nail, then it's not good, but, if things are, you look at things and you're like, okay, maybe there are other ways around this, and you have an open mind, you can learn new things. And I think that's how I've, tried to help my practice while we've had this COVID-19, as you have too. I think most practitioners and providers have noticed, if you don't update with the times, you're going to get, they're going to get left behind.
Oh yeah. Oh, that's the truth. Yeah. I mean, just talking to former colleagues and friends and stuff like that, I know that a lot are hurting, unfortunately, but we're hopeful, knock on wood, that they'll all make it back, they'll all find ground again. Um, so during these surgeries that you are trying not to do, you can tell a lot about a surgeon based on the music that they listen to, I've heard. So in the operating room, what are you listening to?
So I usually listen to hip hop barbecue. So it's like essentially just 90s rap.
Oh, that's awesome.
And
Okay.
2000, yeah.
So
Because
you heard
I
that,
just,
people. That's what you get if you're.
yeah,
All right, hip hop barbecue. Where can I find hip hop barbecue? Is that on Siri or is that?
I think it's a Pandora station. So if you just type in hip hop barbecue, it's like basically if you were barbecuing out and you just want to just chillax and listen to, like, Dre and Nelly or somebody, like, just you just chill, listen to all the best songs they made for these 20 years. That's what just comes on, and you don't have to think about it. It's called hip hop barbecue. So I love it, because I know whatever I'm listening to, if it's Snoop or whatever, it's like their best songs of those 20 years. You
Fair
know,
enough.
so I like it. So yeah, it's usually what I listen to when I'm doing surgical procedures. I think it's a good, it's just it's easy. I can, like, listen to it. It'll make me in a good mood. It's chill. I know most of the songs. I can listen to them, and I know some of the words. I'm good to go.
Solid. That's awesome. Good.
Yeah.
And any pre or post surgical rituals like leading into that music? You got anything you like? I mean, surgeons are like athletes. They have their ritual before and after usually that make them the best at what they do.
I
Do
like
you
that
have any?
analogy. I would agree that I think healthcare professionals in general are athletes. And I think that what we don't look at is, you sacrifice your time, and you make a commitment to be the best. People are sending a text message. I apologize. Um,
Oh
you
no, you're
know,
okay.
you sacrifice time, and you sacrifice, you know, you know, a lot of, of your time essentially, and you focus on that, and you dedicate that, and you give up things to become a master of your, your different, whatever it is in healthcare. If you're an athlete, you give up time and you don't go party or whatever, you don't drink or whatever, you try to control your diet. In medicine, we do something similar. You give up your free time to focus on, your craft. And as you spend more time, hyper focusing and sharpening your craft and getting better at it, you become, a professional in that field, and you become like an authority, and, people follow you and listen to what you have to say. I think that, as a surgeon, I guess my ritual is usually just like a moment of prayer, over the body before I get started, because it really is, a humbling experience to be able to operate on somebody. They're letting you look at the maps of their body, and everybody's body has a map. And, as a surgeon, your job is to get in there, look at that map, respect it, and then close it back up again. And I'm always thinking of the way out when I'm going in, like, how am I going to get out? How am I going to get out? How am I going to get out? Because you need to make sure it looks nice when you're done. And that's why I called our practice cosmetic urology, because I can change the way people look. Hormonally, I've taken people that have low testosterone of 50 for a man and send them to, 600, 700. They look like different people. I take women that have testosterones of 0 or near 0, and I bring them up to like 40, or 30 nanograms per deciliter, and they're different women. They have better focus, better energy, better libido, better sex drive. So I care about how the person looks when they come in and how they look surgically as well. So those are the rituals that I have before surgery. I will be honest, like, if you talk to my scrub nurse Audrey, I have some pretty crazy things that I do before surgery, as far as like hyper focusing on like what I'm doing, and like looking at what's happening and block everything else out to try to give my focus and full attention to that patient.
Awesome. So no like knocking on the door 3 times before you walk in kind of thing.
No, Lipschultz would do, my mentor when I was in fellowship. He would have holy water. He'd
Okay.
have you spritz him with holy water before he'd go in.
There you go.
None of that. No. Just silently pray over the body and then get started, get your surgery going.
Very nice. Very respectful. I like it. You're so now your kids. You are the son of the founder of the Hacky Cath, correct?
Yes.
So are
Yeah.
your kids going to follow in Dr. Tariq Hakky's footsteps? Are they going to be little urologists one day?
I don't know. My dad invented the Hacky catheter, and I think that, I think there's a few other things. There's the Hacky equation, which is the surface area of the aortic valve, and there's other like stuff out there. I just want them to be best at whatever they want to do professionally. I think that, for me, I was never forced into going to medicine. I liked this. I thought it was cool. I was like, I remember being 13 years old, and I would follow my dad into the office, and then this guy standing outside, he was the VA at the time. And this guy just like lifts up his gown, and his balls are massive. And I was like, Dad, what's wrong with him? He's like, I'll take care of it. Like, he had a hernia. Like, all of his intestines had fallen into his scrotum.
Oh my gosh, this must be
So
traumatizing.
I know, I was interested. I was
It
like,
lets
what's
you
that?
become.
I was like, why are his balls massive? But for me, it was something that I just had a passion in. I would never force my kids to go into this. I mean, you got to have a passion for it. Just like PT, you have a passion for it. You get paid, peanuts, and you have to make it a passion. That way, you never work a day. If you love what you do, then you're not working. And then other people work a job. I, come to do my hobby, urology.
That's awesome.
Love it. When you love what you do, it's not work anymore.
That's great. That's great to hear. Any any potential, like, do they have any idea what they like want to become one day? A firefighter,
Oh,
a
I think
garbage
Adam wants to be
man,
a police officer. That's what he told me. So I told him,
police
I was like,
officer?
I'm sure my wife will love that. Here when he wants to be a police officer, she's gonna make him buy all the protective gear. She's worried about him getting hurt doing that. So
Oh, great.
for physical therapy in relation to you, we send you a lot of folks that have a lot of pelvic and perineal pain, especially after surgeries. And I think that it's really important for you to tell, your patients and also other providers, maybe they need to reach out to other urologists and get them to say, hey, and gynecologists too, and urogynecologists,
Mm-hmm.
and even colorectal surgeons, to make sure you get the, hey, I'm here because I would send you guys folks when I first arrived in Atlanta and I didn't know you existed. I would just say, go to physical therapy, and I'd write pelvic floor therapy specifically on there because I didn't know if it was available. And I was like, I know I need this,
Yeah.
but if you make it known and you let people know that you're there, then they'll send you the referrals back. And I think that's a really important caveat. If I was, just telling you, hey, look, from my standpoint, I'd like to make sure that, I know you guys exist because a lot of people don't, and you guys are definitely underutilized as physical therapy, so I think that's just something important.
Absolutely. I appreciate you sharing that with us too. I'm glad you brought up urogynecologists because I did notice when up in the Northeast, there were a lot more, there's a higher presence of urogynecologists versus one or the other. And then down here, it seems like you have a lot of urologists and gynecologists. And I'm glad you brought that up because I think some people just don't know that they exist in terms of physical
Yeah.
therapists in this area. So that,
And there's two
yeah.
ways to become a urogynecologist, right? You can be a gynecologist that does a fellowship in urogynecology, or you can be a urologist that does a fellowship in urogynecology. So there are kind of two ways to make them. The problem is most of the fellowship programs to birth these baby new urogynecologists are all up north.
Mm-hmm. Oh, I see.
So
Okay.
most people here are transplant.
Yep. That might be why we're starting to see a few trickle down at a time, I guess.
Yeah, and I think that it's they definitely fill a role because if you're, especially if you're a gynecologist becoming a urogynecologist, you have a different flair and skill set than a urologist being a urogynecologist. I think there's definitely subtle differences between the two, and they're both, I think, very important. And while I'm not a urogynecologist, I still refer to physical therapy for a lot of pelvic pain. I have a lot of patients that have a lot of pelvic and perineal pain after hernia surgeries, traumas, varicoceles, other surgeries that are done to the pelvis, radical prostatectomies, colon surgeries. They have a lot of pelvic and perineal pain. And so, we try to treat them conservatively with pelvic blocks, anti-inflammatories, neuropathics, and physical therapy.
That's great. Now, when would you say in the treatment plan? And I'll try to keep this brief. I know you're busy. When in your treatment plans typically would you refer physical therapy? Is it more a pre-physical therapy, pre-surgery physical therapy, post-surgical physical therapy, or do you do a pre and post typically? When do you like to see someone try to get into a physical therapist as it pertains to some of the surgeries that you do?
I usually send them because usually I'm seeing somebody after an incident happens. So I usually send them to see physical therapy once they have some sort of an injury. If they have pain, I see a lot of guys that have this like groin pain, and sometimes that's a pulled muscle from poor form when they're working out. Sometimes it's, pulling a muscle from, intercourse or whatever, or just moving a couch. I had a guy I saw last month who was helping somebody move somebody's couch, and I was like, and he has ball pain and groin pain. So usually I see somebody on the back end, but being proactive in anything in medicine always makes sense. If somebody's had or gonna have a problem, it's always easier to catch them on the pre end, to educate them on proper body mechanics or pelvic tightening exercises. I also use it for ejaculatory dysfunction as well. So I definitely say the wide range of things, but usually I see patients once they've had an issue.
Okay, that's fair. Well, Dr. Hackey, are there any parting words you'd like to give to our audience?
No, man, just be safe, and if there's anything that we can do for you here at ACU, please give us a call and or visit our website to see what we offer. And just like we'll keep sending you guys folks to take care of. And if there's anything else I can do or do for anybody, just let me know.
All right. We appreciate you in what you do. We appreciate you for your time today, and we look forward to talk to you soon.
Thank you. I'll talk to you later, Nick.
All right. Thank you, Dr. Aggie.